All my life I was a healthy person, and I always felt like my body would tell me when I had a problem, and it had not told me I had a problem. So I was shocked to hear that I had something as serious as stage 4 cancer. I was diagnosed with metastatic prostate cancer in January of 2019. I went through Provenge immunotherapy in June of 2020, and the results of that therapy has put me where I am now, where I have no noticeable metastatic disease and am only on long-term hormone therapy. A year and a half after I was diagnosed, I had my first infusion from Provenge in May of 2020. I had no side effects at all. This was my experience, others may be different. After my final infusion, they did the normal scans, and when I saw my doctor, he actually stepped up and hugged me. We are still fighting this disease, but you and your wife need to go celebrate. All of my metastatic disease was no longer visible in the scans. Provenge was absolutely the right choice for me. I made it a mission of my own to talk with any man that'll listen to me to make sure that they understand they need to go and get tested. Becoming an ambassador for Provenge was part of the journey to be able to reach as many men as I could. Provenge has impacted my life drastically. It caused me to recognize that I could have a much longer life than originally offered to me by multiple oncologists. And it made me look at where I wanted to go from here, where I wanted to take my life from here. It has caused me to decide to retire at an early age, and that has been a blessing to me to be able to spend more time with my family and spend more time doing the things that I love to do.
Indication: Provenge, Sapulus LT, is a prescription medicine used to treat certain men with advanced prostate cancer. Provenge is an established cellular immunotherapy and is customized to each individual by using his own immune cells. Important safety information. Before receiving Provenge, tell your doctor about any medical conditions, including heart or lung problems, or if you have had a stroke. Tell your doctor about any medicines you take, including prescription and non-prescription drugs, vitamins, or dietary supplements. The most common side effects of Provenge include chills, fatigue, fever, back pain, nausea, joint ache, and headache. These are not all the possible side effects of Provenge treatment. Provenge is made from your own immune cells, which are collected during a process called leukapheresis. The cells are processed, returned, and then infused back into the patient through an IV, intravenous infusion, approximately 3 days later. This process is completed in 3 cycles about 2 weeks apart. Each infusion takes approximately 1 hour and requires 30 minutes of post-infusion monitoring. Provenge infusion can cause serious reactions. Tell your doctor right away if you have signs of a heart attack or lung problems, such as trouble breathing, chest pains, racing or irregular heartbeats, high or low blood pressure, dizziness, fainting, nausea, or vomiting. Have signs of a stroke, such as numbness or weakness on one side of the body, decreased vision in one eye, or difficulty speaking. Develop symptoms of thrombosis, which may include pain and/or swelling of an arm or leg with warmth over the affected area, discoloration of an arm or leg, shortness of breath, chest pain that worsens on deep breathing. Have signs of an infection, such as a fever over 100 degrees Fahrenheit, redness or pain at the infusion or collection sites. Tell your doctor about any side effects that concern you or do not go away. For more information, talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see accompanying full prescribing information.